Hello, doctors. Hello, students. Once again, welcome to our 90-day University Prof pre-final mastery course. So today we are in systemic bacteriology, topic 7. So you know all the things again to say it once again what is happening in Auricle. So there is a rapid revision of all important questions and important volatile facts of quick revision, and high-yield topics will be discussed and most expected topic will be discussed. Okay, so this is basically mainly it is for university prof exam, but not just for prof, it's also used for very helpful for your next or neet exam and FMG exams also. So it is very helpful, will be very helpful for you people. And these are the questions we talk today. Mostly short notes and all important questions from Will Felix, Q Fever, Brill Zinser, Neil Moser. If you notice the name, it is very, very this thing, okay? And then your Bacillus anthrax, sorry for the spelling, it's a printing mistake, and Bartonella quintana. These are the few things, we are all these diseases which are going to discuss, okay? Yes, now, next. So these are the things, benefits of Auricle. So you have recorded classes, live classes, practical session, exam module, hard copy sets. This are frequently, you know this one. And recorded classes, about recorded classes, you know that. And live classes also, which we are having now, which very good in Auricle. And the express exam modules are there. Okay, complete syllabus in 20 hours. Also answering all the writing skills, and expert educators will be there to guide you through all your exam. And then one-to-one doubt clearing session we have, and also we have hard copy sets we have. Also question bank with full of important questions. You can go through it, and practical sessions also will be taught. And then as this is a subscription plan, you check the plan: foundation, advanced, complete learning, and ultimate, and choose whatever suits you. You can use my name, Dr. Santhosh Rajan 20 for more discounts. Okay, so now we're going to start a topic. Wheel-Felix reaction. So first one is your Wheel-Felix reaction. This is a short note question, and a lot of one more question also can come from here. So when you talk about Wheel-Felix reaction, the first thing is that it is a type of, it's a type of heterophile. It is a type of heterophile antibody detection test, or heterophile agglutination test. Okay, heterophile agglutination, or simply you can call it as heterophile antibody detection test also, whatever it is. Okay, it is a type of tube agglutination. Okay, it's a type of tube. Second point, it's a type of tube agglutination. Now, what is the use? It is used to, so when you say heterophile antibody detection test, means it is based on two bacteria sharing same antigen. Okay, that means I'm going to write here, two bacteria, they are sharing two bacteria or virus, anything it can be, when they are sharing, the two organisms sharing same antigenic structure, antigen structure, that leads to cross reactivity. Okay, that leads to, that's called heterophile agglutination, heterophile antibody detection test. Okay, so like example, the Wheel Felix, but also we have Paul Bernal text example, and mycoplasma we have cat test. So these are few classic examples that we are using heterophile antibody detection test. Okay, so now it's a cross reactivity, sharing the same antigen, that result in the cross reactivity. That's a principle. But here, what is the main use? Here we are using it to detect the rickettsia antibody. To detect the rickettsia antibody using which one? Using Proteus antigen. Using Proteus antigen. This is the principle. You are detecting the rickettsia antibody using the Proteus antigen. Okay. So this is the use. So what is the so in procedure, basically what happens is that Proteus antigen, when I say which are the Proteus antigen we are using, Proteus antigen we have, basically important ones are OX19, OX2, and OX-K. OX19 and 2, they belong to Proteus vulgaris. They belong to Proteus vulgaris bacteria. And OX-K, this belongs to Proteus mirabilis group. Mirabilis. Now, when you take the patient sera and then mix with this Proteus antigen, so there will be cross reaction and you will be detecting agglutination. You can see, you can detect. Okay, this is the thing. Now, how to interpret in the rickettsia? So now, next one. So, interpretation in rickettsia. Interpretation or how to classify. Usually we use it for classification only. Okay. So now let's see how it is coming. Interpretation for typhus fever. For typhus fever, both epidemic and for both epidemic and endemic typhus, we will see which is positive, and for scrub typhus, because rickettsia causes these diseases only, right? And the rickettsia also causes spotted fever. Spotted fever, right? So now what happened in your epidemic and endemic, there will be OX19 positive. Usually OX19 positive. 2 is rarely OX19. Okay, but in your scrub typhus, only OXK is positive. Okay, OX K, only OXK is positive. Whereas in spotted fever, both OX19 and OX2 will be positive. Okay. Except one exception, that could be a question also, the rickettsia pox. Rickettsia pox. Rickettsia pox will be negative. There is no any rickettsia pox, all negative. All negative. This is the interpretation. So this can be one mark question also. It can be this thing also. There are false positive, false negative interpretation. That's okay. But main interpretation is this. If you're writing this interpretation, that's more than enough. It's good enough to get 5 mark, complete 5 marks. Or if it's 2 mark, whatever question. So okay, but 1 mark definitely you can, especially scrub typhus, they will ask you in wheel flix reaction which antigen, which cross it forms. The antibodies formed against which antigen? OXK of Proteus. This will be asked frequently. So have an eye and be clear with this. Okay, that's all. Now, next one. So you can see explanation is given here. You can go through this also. I have explained same thing, only simple and sweet. Easily you can score mark. Q fever. What about Q fever? Q fever, yes. Q fever, first of all, etiology. What is the causative agent? The causative agent is Coxiella burnetii. Actually, Cox and Burnetti are the scientists who found this one. Okay, Coxella burnetii. Yes. Now, what is the thing? How it is spreading? What is the route of transmission? What is the route of transmission? Route of transmission. First of all, it is a zoonotic disease. It is coming from animals, right? So zoonotic. It's a zoonotic. Q fever is zoonotic disease. So route of transmission, initially it is to the inhalation route. Inhalation. Other one is your raw milk. Inhalation of any animal product, animal urine or fecus, anything inhales accidentally, it inhales and goes inside body, or raw milk, which is rare. Okay, but most common is inhalation. Okay, this is the route. So this way we get what Coxella burnetii can go inside the body. Okay, fine. Now, what are the clinical features? In clinical feature, what you get is you will have acute, and most important, please remember, no vector. If you see in a rickettsial group of disease, all has vector, but Q fever doesn't have any vector. Okay, clinical feature, you can have it acute or you can have it chronic Q fever. Acute and chronic Q fever, right? Acute and chronic Q fever. So very simple. Q fever, you remember basically what happens in Q fever. Here, I'm going to write it here. Q fever, patient will just have fever plus hepatitis plus some interstitial pneumonia plus they can have myocarditis or pericarditis. Okay, common. But when they have chronic, it's very important. 5% case they have endocarditis. You remember we spoke about endocarditis, culture negative endocarditis. So just very important role endocarditis. So this is an expected question also. You should remember. The rest all are common: hepatitis, pneumonia, everything you can write. But endocarditis, don't forget. You're going to write this. Okay. Yes. Now, what is the next point? Now we are going to do the lab diagnosis. When you're going to put the lab diagnosis, as we told, this is a very fastidious. Remember one more thing also, there is no rash, no vector and no rash in Q fever. Okay. In Q fever, you don't have a rash and you don't have a vector. That's very important. Okay. Now lab diagnosis, if you talk, usually as we told, for culture, very difficult. It's fastidious, no? Fastidious. So it grows only with special, it grows with the special conditions, okay, with the special condition, that's all. Or it's UV can grow, but you need special conditions, special substances are needed for it. So that is bit less used. Then what is important here? Serology. And of course, it is basically, again, Coxella bonita, I forgot to write it here. It is basically an intracellular organism. Intracellular organism, okay? It's intracellular organism. So now next is serology. In serology is good. What? Serology is the only thing which is helping you. That is, you're going to detect the antibodies by which one? Indirect immunofluorescence. Indirect immunofluorescence. Indirect immunofluorescent test you're going to use. Okay. And then this is the main thing. Just two things. Culture is not that much used. Instead, you're going to use the indirect immunofluorescent test and detect the antibody. That's all. So this is for the Q fever. Very, very simple and easy. You can score it well. No need to struggle with this. Right? Now, you're clearing it. Next point. So everything is mentioned. It's called Q fever because for a long time, it was not known. Then only they identified it. Okay. So everything is mentioned very clearly. You can go through it. Okay. Yes. Now, Brill-Zinsser disease. Another. All these fancy names are coming in rickettsia only. Brill-Zinsser and Neal-Moser, all these things. Okay. We're going to talk about that also. So, Brill-Zinsser's disease, first one. First of all, Brill-Zinsser's disease basically, etiology is actually your rickettsia provosaki. Okay. Provosaki. Rickettsia provosaki. Okay, Rickettsia provosaki. Okay. Now, Rickettsia provosaki is the causative agent. So, what is the vector here? You know that the vector is usually here is because it's the Brill-Zinsser disease, which is causing the epidemic typhus. The vector is usually whenever epidemic comes, you will say louse. Always louse. Epidemic level is louse. Okay. So, Rickettsia provosaki, louse. This is the thing. Now, what about the Brill-Zinsser disease? In Brill-Zinsser disease, what will happen is here in Brill-Zinsser, in immunity goes down. In immunocompromised patient, immunocompromised patients, what happened? There will be reoccurrence. This reactivation or recrudescence or reoccurring of what? Basically, this rickettsia provosaki silent will attack, will come out and causes the disease. That's it. Okay. Reemergence of this rickettsia provosaki happens. So again, the patient will be having fever, rash, but severe form. It will be severe form. That is called Brill-Zinsser disease. That's it. Okay. Etiology is basically the re-emergence of rickettsia provosaki. Re-emergence or recrudescence, whatever you want. It means it was silent and now again it's getting reactivation. Okay. Reactivation, re-emergence of rickettsia provosaki in body. When the immunity goes down, then it happens. So basically it's a reactivation of this thing. So this is very simple. Brill-Zinsser disease. So rickettsia provosaki, it causes epidemic typhus. Vector is louse, but when it's reactivated, you're going to get the Brill-Zinsser disease. That's all. Okay. So very simple and easy one. Yes. Now, next. So recrudescence or reoccurrence doesn't matter. Okay. So waning immunity, it happens. Very simple. Okay. Now Neal-Moser reaction. Neal-Moser reaction. How when you talk about Neal-Moser reaction? Neal-Moser reaction is basically an animal pathogenicity test. It's an animal pathogenicity test. We are used, which is used for rickettsia, speciation. To speciate rickettsia, okay? But now it's absolute. Now it's not used. Okay, now it's not used. Okay, now what are the procedure? The procedure is which is the animal we are going to use here? We are going to use the the procedure is we are going to use which animal? Guinea pig. Guinea pig is taken and then the Rickettsia species, the Rickettsia, which you have to identify, okay, the Rickettsia is injected into the peritoneum of guinea pig, peritoneum of the guinea pig, yeah, peritoneum guinea pig. Then what happened after some, even after injecting, after a few days, you will see what? You will see the scrotal inflammation. Scrotal inflammation, or there can be necrosis also, necrosis and adhesions and all. So, okay, so this is basically called, when you have this thing, then that is called as your tunica reaction. Tunica of the scrotum, no, we have tunica layer. Tunica reaction or Neal-Moser reaction. Okay, Neal-Moser reaction. So the guinea pig, the guinea pig, what are you doing? You're injecting it, so its testis gets what? Inflamed. That's it. Okay. So tunica reaction, Neal-Moser reaction. Now, if it is positive, so which are the animals? So interpretation. Interpretation is, if it is positive, the positive test means it could be 3 rickettsias. Okay, you can include 3 rickettsia. This also can be an objective question also. This can be an objective question also, so better to know. Positive is remember as CAT, C-A-T. Shortcut is CAT. Okay, so how to remember? Rickettsia, rickettsia, rickettsia conori, A for rickettsia acari, T for rickettsia C-A, T for rickettsia typhi, but where not in Rickettsia provosaki. Okay, Rickettsia provosaki. It will not come in the Rickettsia provosaki. It is absent. It will not be positive in Rickettsia provosaki. This much only. Very, very simple. Okay. So 3. This can be, that's what I'm saying. This can be important. 1 more question. In Rickettsia provosaki will never give positive for Neal-Moser reaction. Okay. The animal is guinea pig is used. Okay. Guinea pig is important word, and which are positive is word. So you have scrotal inflammation. This is the Neal-Moser reaction. Very, very simple and easy. Basically for Rickettsia species. Now it's obsolete. We are not using it. Okay. That's all. This much only you should remember. Okay. Now, next. Everything is mentioned here. Okay, clearly. Now, Bacillus anthrax is an important topic. So you have to be, it can be long question also, can be short question. So whatever it comes, you should be ready to answer it well. Okay. Now, Bacillus anthrax. So the disease causing is anthrax. This is Bacillus anthracis. Actually, the organism name is Bacillus anthracis. You should say it as Bacillus anthracis. Okay, Bacillus anthracis. Okay. Now, we go start from the morphology. First of all, basic. What about the bacteria? The bacteria Bacillus anthrax is, of course, it is a gram-positive bacilli with spores. It has a spores and capsule. Spores and capsule. But the most important question is capsule. Capsule is made up of, usually it's made up of polysaccharide. But this one here, it is made up of polypeptide. Polypeptide. This is the exceptional case. Okay, because it is amino acids. A for anthrax, A for amino acid. You can remember like that also. Okay, anthrax and amino acid. Easy. Okay, glutamate. Basically, which one to glutamate? Glutamate. This is very, very important. So based on that diagnostic part also, if for capsule diagnosis, you have different type of procedures. Okay, right. So this is the bit. Now next is your virulence factor. Virulence factor, you know, of course, whenever there's a capsule, that is the main virulence factor always. So here is this capsule. First word, it's a capsule 1. We just spoke polypeptide. It's a polypeptide capsule. And second one is there's a factor called edema factor, lethal factor. We have edema factor and lethal factor, which is causing that anthrax ka main the disease, no? This one. So how does this, especially edema factor, the mechanism of protein, how it is working is important. It acts through cyclic AMP mechanism, and then decreases the, so cyclic AMP means, you know, that will go work through the AC, cyclic AMP AC, and then it causes the disease. The disease is caused, the disease pathogenesis will happen like that only. Okay, so virulence factor. Now, the diseases. Now, what are the diseases are important here? So, so disease, we'll write it here, no problem. So, when we talk about the disease, so here, what are the important diseases? You know that if we have 2 types, basically most important is 2 types only. One is your cutaneous anthrax. Other one is your pulmonary pulmonary anthrax. Each one, the name is very, very important because the cutaneous anthrax is otherwise called as Hailey Potter, right? Hailey Potter disease. Hailey Potter disease. Animal handlers. So that's what this is basically. Bacillus anthrax is a zoonotic disease. It's also zoonotic disease. Zoonotic disease. Okay, zoonotic disease like our Yersinia plague, anthrax also. Okay, so Harry Potter for pulmonary anthrax, it's inhalation. No, so it's called wool sorter. Wool inhale. No, so wool sorter's disease. So both basically animal handling. Both are the main thing would be because of animal handling only. Okay. Now cutaneous anthrax is the most common form. Here, the characteristic lesion form, we call it as the malignant pustule, but it's not painful. Okay, malignant pustule, but it's not really malignant. It's a malignant pustule. There's a painless eschar. Painless. The picture I'll show you in a while. Malignant pustule or painless eschar is characteristic lesion. That's it. Okay, fine. Now, so this is usually hydropotamus animal handlers. Any animal handlers, animal handlers who works with the animal, okay, animal skin, who's carrying the animal skin, anybody with animal skin workers, they get cutaneous. Pulmonary is due to wool visual, so wool shorter disease. So this one usually causes the hemorrhagic pneumonia. That's what it is, very dangerous. Hemorrhagic pneumonia. So this is the most severe form. This is the most, every question here is important. You will have easily they'll ask you a question. Here also very important. The other name is very important. Hemorrhagic pneumonia is the most dangerous form. The most dangerous form is pulmonary anthrax wool sorter disease. Okay, fine. Now, next. Sorry. So now the disease is over. Now the important part is diagnostic part. Diagnostic part is the very, very important. Diagnosis part itself can be a short note. They can ask you as a diagnosis of this Bacillus anthracis. How to diagnose? See, first of all, we already told that the diagnosis we can classify like this. First one for capsule. For capsule, how do you stain and what you will get? Okay, capsule. Second one on gram stain. On gram stain, what do you see exactly? Then comes your culture. So in culture, we have many things here in culture, very important. Culture in the agar plate, how it will grow in the normal agar plate. That is very, very important because many questions are asked from this diagnosis of Bacillus anthracis, especially 1 mark, it's very, very important. So in agar plate, how it goes, and then in penicillium, again, penicillin, okay. In penicillin agar, how it grows, and then in the next one is your how it grows in the agar slab. When you put it in a slab, agar slab, okay, how it grows, okay, and then selective media. These all medias are very, very important. Selective media. Okay, and then of course, not last but not least, your it also has a some precipitation test. Okay, one of the precipitation test. Okay, we're going to write everything now. Now, capsule. Capsule, we just told it is made up of special thing that is polypeptide. It is made up of polypeptide. So, for staining this, we use a reaction called McFadden's. McFadden's reaction. McFadden's reaction is basically what happened when you're staining with the methylene blue. When you stain with the methylene blue, you will see a purple capsule. You will see purple capsule. You know very well, so I no need to stress on this purple capsule. Gram stain, of course, Bacillus anthracis is a bamboo stick. Bamboo. Bacillus anthracis is bamboo. Bamboo stick appearance. I'll show you the picture in a while. Okay. Now, agar plate, basically, when you grow it in an agar plate, you will be seeing what you will see a Medosa head colony. Medosa head colony with frosted appearance, frosted ice appearance, okay. In penicillin agar P, so you see what? Pearl-like reaction. It looks like pearls, okay. In agar slab, you get a inverted fir tree or Christmas tree. Inverted fir tree or Christmas tree appearance, okay. Selective media, PLET media. This is basically polymyxin, lysine, electrolyte media, okay. PLET media, taurolate, some substance will come there. Do you know? Just remember PLET media. That's it, okay. PLET media. Precipitation, it is basically ascolic thermoprecipitation. Ascoli thermoprecipitation reaction. That's it. This one, this much. If you write, the examiners will be very happy and they'll give you full mark, no doubt in it. Okay, now let's see. Even spore staining you can write. If it, no, I can add it here also. Capsule we told for spores, because it has the spores, we know that the spores can be stained by, that's Ashby and Schaffer-Fulton stain. Schaffer-Fulton stain. Okay, these things, everything is mentioned. You can use for staining the spore, but usually gram stains of you will see very well, bamboo stick appearance. Okay, now look at the picture. This is explanations. Everything is here. Okay, you can go through explanation, everything mentioned here. Then comes your Bacillus anthrax. So this is your bamboo stick appearance, what you're seeing here, and then you can see this the colonies, frosted Medusa head colonies. Here pearl-like reaction, and here is inverted filtry appearance. You can see, and then here this is the thermole ASCO precipitation test. Okay, so this is the Ascoli thermoprecipitation ring test. You can see a ring here, ring. Okay, basically it is the antigen antibody sort of reaction only. You can see it. That's it. Okay, so these are the things you will see right in the Bacillus anthrax. Very simple and easy scoring. You can get it. Now, next is a Bartonella quintana. Bartonella quintana, now this one, what it causes? Now, Bartonella quintana, usually it causes, remember, queen, like that. Okay, so this is basically causing trench fever, or we call 5 days fever. 5-day, 5th-day fever, 5-day fever, whatever. Okay, every 5-day fever will come. Okay, Bartonella quintana, usually how it is transmitted? This is usually transmitted by louse, body louse. Okay, it was very common in the why it is called trench? Because it is very common in the military who are working in the trenched places. Trenched places means the places where very narrow places, narrow place, very unhygienic, very unhygienic places where they have to live. So there only this disease started. So here what happened basically, the clinical feature is basically they were having fever every 5th day. There was fever every 5th day. Okay, one is louse important, other one every 5th day there was a fever. That's what it is. Nowadays, again, it has increased, especially in US, it's increased. So main thing is trench fever could be a 1 mark question also, because it's a name question. Trench fever, 5th day, these are very commonly asked question like this. Okay, so this is fine. Now, apart from that, other diseases, apart from the trench fever, the Bartonella quintana also causes some other conditions called bacillary angiomatosis. Bacillary angiomatosis. This is also another important disease caused by Bartonella fumigate. Okay, Bartonella quintana. So that's it. These are the things you're going to do. Of course, here we don't know culture. You can do only serology, PCR sometimes, but serology is enough. Serology, you'll do ELISA, any other indirect immunofluorescence test, etc. And you can find it. Okay, that's it. This much only about your Bartonella quintana. This much. Okay, so everything is explained here. You can see here. Okay, trench fever when it occurred and all the things, what are the symptoms, but remain endocarditis also. Quintana also can cause endocarditis. Okay, fine. That's all. So we are done for today. So you guys can go through it. If any doubt is there, we'll come to next upcoming classes. We'll discuss about it when your questions are written, be explained. Okay, that's all. Thank you.